Hello, I am Sister Tandy. This video addresses the question that often crosses people's minds after a medical examination. What do my results actually mean? For employees, understanding your results puts you in control of your own health story. For employers, understanding results helps you act on them appropriately and legally. Let us walk through this together, clearly and without jargon. After your examination, the occupational health practitioner assesses all findings and issues a fitness determination. There are 3 possible outcomes. Outcome 1, fit for duty. This means the examination found no conditions that prevent you from safely performing the duties of your current role. You will receive a certificate of fitness which confirms your fitness status and the date of your next required examination. Outcome 2, fit with restrictions. This means you are fit to work, but should be temporarily restricted from certain activities or exposures. For example, a worker with elevated blood pressure might be restricted from working at heights until the condition is managed. This is a protective measure, not a punitive one. Outcome 3, temporarily unfit or referred. In some cases, a finding requires further investigation before a fitness determination can be made. The practitioner will arrange a referral to a relevant specialist or schedule a follow-up examination. No employee should ever receive this outcome without a clear explanation and a clear plan for what happens next. For employers, the Certificate of Fitness is the key document that fulfills your medical surveillance obligation under the OHS Act. It confirms that a qualified occupational health practitioner has examined the employee and has been assessed as fit for the specific duties and hazards of their role. The certificate will state the employee's name, examination date, the type of medical performed, and the next recommended review date. It will not contain any clinical findings. You are not entitled to the clinical details, only the fitness outcome. Store all certificates in accordance with your record-keeping obligations under the OHS Act. Records must be kept for the minimum period required by the applicable industry regulations. If you are unsure of your record-keeping requirements, your CareNet Consultant's account manager can advise you. For employees, receiving your results can feel like a tense moment. Let me help you understand what different findings actually mean. If your blood pressure is elevated, it does not necessarily mean you have hypertension. One reading can be affected by stress, caffeine, or recent activity. The practitioner will note it and may recommend monitoring. If your audiometry results show a shift from a previous examination, this does not automatically mean significant hearing loss. It means the trend needs to be monitored and protective measures may need to be reviewed. If your spirometry result falls outside the expected range, it may indicate a respiratory concern that warrants further investigation. But many factors affect lung function. The practitioner will interpret your result in the full context of your work and health history. The key message is this: a finding is information. It is not a sentence. Information can be acted upon, and at CareNet Consultants, we will help you understand what action is appropriate. This is a point that cannot be stated clearly enough. Your medical results are your personal information. Under the Protection of Personal Information Act, health data is classified as special personal information and is subject to the highest level of protection. Your employer receives only your fitness determination. Your specific clinical results, your blood pressure reading, your audiogram, your spirometry values, your blood test results are not shared with your employer, your supervisor, your HR department, or your colleagues. They are stored securely on the MyClinic online platform and are accessible only to you and the occupational health practitioners responsible for your care. If you ever feel that your medical information has been shared without your consent, you have the right to report this. The CareNet Consultants team can advise you on the appropriate process. Your privacy is not a courtesy. It is a right protected by law. Occasionally, employees tell us they felt pressured by a supervisor or manager to share their clinical results after an examination. Let us be direct about what you are and are not obliged to share. You are obliged to inform your employer of your fitness outcome, fit with restrictions, or referred, because this affects your work placement. You are not obliged to share your clinical findings, diagnoses, medication, or the details behind any result. If your employer asks for your clinical results, it is reasonable to say, the occupational health practitioner communicated the fitness outcome to the business. The clinical details are confidential under the Protection of Personal Information Act. If your employer persists in requesting clinical information they are not entitled to, you may contact the information regulator or seek advice from the Department of Labor. In rare cases, an examination may reveal something that requires urgent medical attention, not just monitoring or follow-up, but immediate action. If this happens, the occupational health practitioner will communicate directly and honestly with you, explain the findings clearly, and advise on the immediate steps to take. They may arrange an urgent referral to a general practitioner or a specialist, or, in serious cases, recommend immediate emergency care. CareNet Consultants takes this responsibility seriously. We do not deliver alarming news without support. We will be with you to explain, to refer, and to follow up. Every examination aims to protect you, and if a finding needs urgent attention, finding it during an examination is far better than not finding it at all. You now understand the 3 fitness outcomes, what a certificate of fitness means for employers, how to read your own results as an employee, and how your privacy is protected under the Protection of Personal Information Act. In our final video, we look at what comes after the examination day for both employers and employees. Next steps, follow-up, wellness support, and how CareNet Consultants continues to partner with you beyond the examination room. Remember, your best is good enough for today. Thank you for learning with me. CareNet Consultants, your partner in workplace health.